Early morning in August 4th, 2010, both men and women arose to exercise their constitutional right and vote to have a new constitution. The most significant changes included parliamentary oversight of most presidential appointments and decisions, constitutional limits on the number of cabinet posts, a Senate to review parliamentary decisions, powerful provincial governments replaced by a network of smaller counties, creation of a Judicial Service Commission, a Citizens' Bill of Rights, Land Commission to return stolen property and review past abuses. Satisfied with the changes, a new constitution was signed into law and the document lifted before the cheering crowds 23 days later. One of the notable changes in the new dispensation was the handing over of the health function to the devolved units to be managed by governors. The move would change access to the critical service, which is a fundamental human right, one which is guaranteed in the Constitution of Kenya. Article 43(1)(a) of the Constitution provides that every person has the right to the highest attainable standard of health, which includes the right to health care services, including reproductive health care. Article 43(2) also provides that a person shall not be denied emergency medical treatment. However, a majority of Kenyans a decade later tell a different story. One Ann Wanjiru, representing a number of Kenyans who cannot afford to pay for medical bills.
Nikatolewa risasi za mguu mbili, alafu hiyo ya kichwa wakasema yezi toka. Tu sasa walifanya operation hapa na hapa katikati, wakasema imeshika mfupa. Wakaweka dawa ya kuua sumu, hivyo ndivyo daktari aliniambia, ile sana nilikuwa nafahamu, na wakaweka ka plastic. Sasa iko katikati wa plastic na mfupa.
And as if Anne is not the only one feeling the pain, Mildred Odhiambo, a single mom of 3, has been living with a stomach hernia for the last 9 years.
Hii ilitoka ikatoka nje sasa the way it is. So akaona ile ya ndani japona. It's like I love another 2 wounds. Akasema kama hii ipone kwanza ndio nirudi now hapo iwezi tengenezwa. Kajata niliendaga line ya nini paka nikachoka cause saa hizo hauna pesa, you hustling watoto. I wasn't able to make it.
She has been forced to make a tough balance of between life and life. Go for surgery and let her children go hungry and not go to school, or continue living in pain but ensure her children have food on the table. As any mother would, Mildred has chosen the latter.
What will I do? This medical condition. I have nothing to do. Sasa uchungu nitazoea tu. Paka I have to work.
And several kilometers from Mildred in Kibra, we meet Jen Anyango, whose 3-year-old son is living with spina bifida.
Vile nilikuwa na watrain kukaa, juu kama ni kwa kuwaeka kwa bisheni nilikuwa na waeka wote. Nikifanya nini nikishughulika na kazi zangu. Sasa ikakuwa huyu mdogo ndiye akaanza kukaa. Nikimweka yeye anarudi tu hivi. Nikimweka anarudi tu hivi. Nikasema simwekangi vitu ama nini. Nikabidi sana nimwekange. Kuna kamato nilikuwa nawaekea kadogo hivi, baba alinunuanga hapa kwa reli. Nakwambia mama, ni last year hata nilikuwa Oktoba. Nakwambia na mama nilitoa machozi kwa hii nyumba yangu. Nikimagine mtu wangu pia atakuja kufanywa upasuaji.
What do these 3 Kenyans have in common?
Sasa siendangi hospitali juu nilikuja kukosa pesa hata ya kwenda kliniki.
Nilijaribu lakini hapa penye imefika nimeshi, lakini yote nimeachia Mungu.
Leo usikienda utatibiwa bure. Hakuna kitu tatoa the same.
Sasa kama ningepata mtu akunisaidia niende hospitali, at least nitibiwe nitolewe hiyo risasi. Juu unaona kata daktari aliniambia ili ichangia kuparalyze kwa goi side.
If access to healthcare is a basic human right, why then are these who represent a majority of Kenyans have been subjected to a suffering of this magnitude? We spoke to Dr. Francis Kenimak, a microbiologist from Kenyatta National and Referral Hospital.
The mwananchi himself is very poor. They cannot afford. When you go to that hospital, they write for you, they give you prescription. They will tell you, buy Panadol, buy this one. They give you all the medicine that you need. But from there, when you go to the pharmacy, the medicines are not there. So you really, now it beats logics. Where are this medicine going?
Dr. Kenny-Mac says not getting it right from the beginning has pushed the health sector further down the drain. The pinch of poor accessibility and affordability of healthcare in the country has not only been felt by Kenyans but healthcare workers as well. From constant strikes in what they term as frustrations from the health ministry has been blamed on lack of a health service commission, which at some point even bring back the debate of whether the health function should be brought back to the national government.
Apart from delayed salaries for over 2 months and now delayed salaries in almost all counties, lack of promotions, and lack of commitment to address human resource issues.
I am so disappointed.
However, what seemed as a beacon of hope to many Kenyans was the launch of a universal health coverage program piloted in 4 counties. 2 years later, the program has established ground in some counties, while in some it is yet to pick up. Dr. Kenny-Mac continues to say corruption, which is deeply rooted in all health entities and agencies, including the National Health Insurance Fund, is the biggest hurdle.
You can imagine from the time of the Constitution promulgation up to now, the coverage have improved from 4% to around 12%. But now, they have issues now. They give you, they approve maybe specific percentage, which is very low, and you are supposed to top up.
As the country is reeling from the effects of poor governance and lack of proper policy implementation as well as corruption, COVID-19 struck and literally put the world to a standstill, unmasking the underbelly of the sick state of health in our country, which boasts of having one of the largest economies in the region.
Only solution to a standardized and centralized management of human resources for health is the creation of a health services commission.
And if that was enough, the Kenya Medical Supplies Agency scandal brewed, and till now, COVID-19 millionaires, as they are known, have not been held accountable.
I think for us to move, we should, even this KEMSA thing should be devolved, so that we have like 5 or even 4 KEMSAs, so that issues can be sorted out at specific, and even those allocations must be specific, that this is KEMSA for northern region, this is KEMSA for southern region, maybe western region, so that now they can manage those issues around there.
The scandals involving millions of shillings meant to combat the contagion now in the pockets of a few selfish individuals begs the question, 10 years later, are we making strides towards attaining free healthcare for all, or are we going back to where we were? Well, despite numerous misses recorded in the healthcare sector, a number of positives have been reported as well, including devolution of healthcare functions to counties, which has created job opportunities for many medical workers, as well as many Kenyans having easy access to healthcare facilities. Winnie Lubembe for Every TV.